Good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I'll be your host for our program tonight on ENT Problems. We will be glad to take your questions on hearing loss, ear, nose, sinus, and throat problems. The success of this program is very dependent on you, the viewer. Please call in your questions and we'll do our best to address them. The telephone numbers for your questions can be found at the bottom of your screen. Our panelists tonight include Dr. Todd Freeman, an ENT specialist with Northland Ear, Nose, and Throat Associates, Dr. Jonathan Glickstein, an ENT specialist with Essentia Health, Dr. Jake Pernuski, a family physician with the Lake Superior Community Health Center and faculty member in the Department of Family Medicine and Community Health at the Medical School Duluth. Our medical students answering phones tonight are Jackson Long of Andover, Minnesota, Christy Nowak from Rogers, Minnesota, and Dan Stevem from Staples, Minnesota. And now on to tonight's program on ENT problems. Well, maybe we could just start out with Dr. Freeman. I know this question is going to come up. It'll be something like, my husband snores, what can I do?
Well, the important thing to try to determine is if there's something more than just snoring there, and what we don't want that to be as a warning sign of obstructive sleep apnea. And typically, probably the most important element of the history in those patients is a bed partner observing that patient stopping breathing. And aside from that, it would be the patient just sleeping longer hours and waking up fatigued, chronic headache problems, particularly morning headaches. Those are the main historical things we're looking for to rule out sleep apnea. Aside from that, assuming they don't have that, dealing with snoring, there's pretty limited options to help. Probably the first three things on the list would be weight loss, and then weight loss, and then weight loss. And then after that, avoiding sedating substances, establishing a very regular sleep cycle, so you're going to bed the same time, getting up the same time. And then finally, regular exercise. There seems to be some benefit aside from the weight loss effect that helps people sleep more efficiently and snore less.
So sedating substances like alcohol? Would that
alcohol, antihistamines, muscle relaxants, pain medicines, anything that tends to make you more sleepy and sedated.
Thank you. Well, Dr. Glickstein, we already have a question that was called in earlier today from Duluth. Will the exercise of tilting your head back and opening and closing your mouth help if you have sleep apnea?
That would depend a lot. I would have to say probably not. You'd have to identify very specific factors in someone who has obstructive sleep apnea that would particularly be helping with. But again, more or less to echo what my colleague Dr. Freeman said, these are the things I think would probably be more effective than trying to, let's say, lose that tire in the middle of our waist.
Sure, sure. Dr. Pernuski, another common question is going to revolve around sinus infections. I've got a lot of people have sinus troubles, and what do you do for a sinus infection?
Well, you're right in that a lot of people have sinus problems. Certainly in a primary care practice, we see sinus problems on a regular basis. I think the biggest challenge for us as doctors is really identifying the cause of a sinus infection. Many people will have face pain, sinus pressure, discharge of one color or another. And the challenge for us is trying to decide whether that's caused by a bacterial infection, essentially microbes growing in our nose, a virus infection, or other causes like allergies or abnormal blood flow problems. Clinically, it's really hard in that there aren't a lot of things we can do either on talking with our patients, examining our patients, or through studies or tests to tell the difference between those things. In general, the most common cause of sinus infection and sinus symptoms are viruses. And in general, antibiotics don't help sinus infections when you look at a general population because we can't distinguish between the exact cause.
So antibiotics are not always the best choice.
They're not always the best choice. There's certainly a place for antibiotics in selected patients, but I think it's a safe assumption to say that the majority of patients probably don't need antibiotics for sinus infections. if you have an infection that's not getting better with time, or if you have other health problems, there may be reasons to consider antibiotics, and it would be something you'd want to talk to your doctor about.
Thank you. Well, Dr. Freeman, staying on the subject of sinus infections, by the time they get to your office, they probably had repeated sinus infections. Are there surgeries in that can be done?
In the chronic setting where people have lingering symptoms that last beyond 3 months, our primary concern is establishing drainage and ventilation. And to do that medically, we use steroid sprays and a lot of saltwater irrigations. But then we do have endoscopic work we can do to help with that as well.
Okay, so there can be procedures done that aren't involving major surgery for
They're
sinus.
usually day surgery procedures and done under local with sedation and not requiring general anesthetics. So
Okay.
they can be
Good. Well,
done
Dr.
pretty
Glickstein, here's a question I have. What about the Neti Pot? Now, what's that all about?
Well, I do think, number one, that the concept of a neti pot is excellent. I sometimes do get puzzled when patients will tell me that, well, it comes out one side but not the other, and what is the significance of that? And to be honest with you, it puzzles me a little bit, but anatomically I almost never find any reason for that. I find that it probably just has something to do with the patient's head position. But I do think that, number one, studies have shown that saline and in higher concentrations actually improves the microscopic hair fiber function that moves the mucus blankets in and around our sinuses and intranasal passages. Also, the nasal function really has a lot to do with humidification as well as filtering. So if patients happen to have allergies, the antigens such as dust mites or mold spores, etc., get stuck within our nose, and then the nose produces mucus and inflammatory response to try to get rid of it. Washing the nose with a Neti Pot or some other commercially available product is certainly a reasonable thing to help decontaminate your nose.
Interesting. Thank you. Well, Dr. Pernuski, we have a caller from Hayward, and it's interesting. We were talking about this exact subject just before we came on the air. The question is, what is the prevalence of HPV and throat cancer? And can the HPV vaccine help alleviate any risks?
So it's a very good question. There is growing evidence that throat cancer is caused predominantly, or at least in a large part, by HPV, which is a virus infection. HPV causes warts, and we can get warts in many different places of our body. There are hundreds of different kinds of HPV virus. Those types which can grow in the throat or mouth can cause cancer. That problem is probably made worse in people who smoke, and so certainly we want people not to smoke. As far as whether or not the HPV vaccine is beneficial in this setting, we don't know. That study hasn't been done, and I think it's certainly something that will be looked at as this becomes more prevalent. The other thing is the HPV vaccine right now is limited to use in younger people. So it's approved from age 9 up to age 26 in boys and girls, men and women both, but not for people older than that at this time. In general, those age ranges expand as we get more experience with the vaccine. But I think probably one of the most important things that people can do is recognize this, and if they notice a growth in their mouth or throat, to see their doctor and have it evaluated.
Okay, thank you. Interesting.
I think there's kind of additional point there too that we're finding. We're not sure that HPV is causing these cancers, but we are seeing the DNA in these cancers, and the ones that we do, those tend to be a better prognosis tumor. That's the one thing that's coming through. We're not sure that they're causing them, but if that's present, that may be a good prognostic factor and help us maybe back off and be a little aggressive, less aggressive in treating those patients. That science hasn't evolved to the point where we're actually doing that yet, though.
Thank you. Well, Dr. Freeman, we have a caller from Duluth wondering, what could cause someone to wake up in the middle of the night to clear his throat?
I think probably there can be a variety of things, but probably the one thing I think that will be a problem in the majority of these patients is reflux. And in a lot of our ear, nose, and throat training that we'll do, in the last 10 or 15 years, they've really emphasized this laryngopharyngeal reflux, which just means reflux that's occurring up to the level of the larynx and
From
the
the
throat,
stomach.
from the stomach.
Yeah.
And this acid reflux, oftentimes these patients don't have classic GERD symptoms of heartburn or gas. They'll just have symptoms like waking up, coughing, or chronic cough, voice changes, irritation in the throat, a tight feeling in the throat, vague swallowing issues. But a lot of these things are a reflux-mediated symptom and can respond to, especially to these proton pump inhibitors that we use.
Thank you. Dr. Glickstein, we have a caller here from Duluth. One interesting question. What might be the cause of someone losing their sense of taste and smell after a virus? And can anything be done to help this?
There are certain viruses that can attack the nerve cell fibers of smell, which are up in the roof of the nasal passage and sinuses. And unfortunately, most patients who've had this particular problem, many of them will not recover their loss of sense of smell. If it is a mechanical issue, meaning that the smell particles aren't getting to the top part of the nose and the sinuses, using nasal saline or a topical nasal steroid preparation, which can actually help decongest and open up the airway, can actually help improve. But as the caller correctly points out, a loss of sense of smell will result in a loss of taste.
The two go together. Thank you. We have a caller from Two Harbors, Dr. Pernuski. How long do allergy shots confer protection? Are they lifelong?
I'm going to defer to my colleagues on this question. Allergy shots are usually given as a series, and if they boost the immune system, with a successful treatment should convey lifelong or near lifelong treatment. Now, our immune system does weaken as we age, and with most vaccines or most things like this, things can get worse at sort of the extreme ends of life. Defer to your expertise if you've got anything to add to that.
I think you handled that fine. I agree. It is a long process. It's usually several years going through these desensitization procedures, but they can make pretty dramatic benefits. Nothing cures an allergy. You were just improving your tolerance to the allergen by the kind of repeated limited exposure.
Thank you.
I think, I'm sorry. I just think another point to be made, of course, is that I will find that patients who've been tested previously, let's say several years ago, and may be allergic to one or two things, could subsequently develop allergies to different antigens, and so it's not unreasonable if several years have passed and new symptoms have arisen then to be retested.
One of the other really important pieces with allergies is I think a first-line step for most people is just avoiding the exposure. And there are lots of environmental things that people can control in their house or their workplace which can help reduce the risk of allergy-related symptoms and allergy-related problems. Certainly allergy shots are appropriate and very helpful for many folks, and there's a good role for them. I also think that looking at the environment and what you can do to minimize or to make less your symptoms just by changing your environment can be really helpful.
Thank you. Dr. Freeman, here's another good question, very common thing about what causes severe earwax buildup despite using eardrops and cleaning your ears?
Well, I like to tell people the ear is a self-cleaning unit. I mean, the skin grows from your eardrum out, and the wax is secreted in the outer third of your ear canal. And most people who have problems with a lot of earwax is because they're muzzle loading with a Q-tip. But there's a small percentage of people who just continue to build up wax.
Is it a structural problem or has trouble getting out? Or
it's who knows for sure.
Okay.
But I think the vast majority of people who really have problems, it's a self-created problem. But the people who, if you have the issue, there are over-the-counter earwax preparations where you use a drop and then a flush, and they can be fairly effective. Some people just need to be mechanically cleared, and that's where we come in.
Right.
Often people with dermatologic conditions such as eczema or psoriasis or seborrhea, I find that it's not necessarily wax, but it's just a buildup of sort of dead skin within their ear canals. And often those patients do need some sort of medical treatment in addition to the debridement.
Interesting. Okay. Well, here's Dr. Glickstein, here's another question. Tinnitus. Are there any new treatments or therapies? A caller from Duluth.
New, I suppose I'd have to know the point of reference, but there are always sort of projects, I think, ongoing in terms of treating tinnitus, because it's one of the more frustrating problems that patients present with, because to date, other than distraction or adding sort of white noise to the environment, whether that's a wave machine or turning the dial between radio stations and sort of listening to the static, there are also some dietary supplements. There's only one that I'm aware of that's FDA, well, I shouldn't say FDA approved, but it's been shown in a research study to help decrease ringing in patients with a very specific ear problem called Meniere's syndrome. There are what's called biofeedback techniques, and a couple of audiologists in town are actually interested in helping patients sort of use biofeedback to overcome their tinnitus and become less aware of it rather than actually making it go away. And then the fourth thing is if you have true hearing loss, treating the hearing loss, whether it's through amplification, often that can be up to 80% successful in patients with sensory hearing loss, or if a patient has vibrational hearing loss that's amenable to surgical correction, that could, in theory, in some patients, improve their ringing.
Okay. I'll ask Dr. Pernuski this question, a caller from Chisholm. What would cause someone to have a stuffy nose on one side only?
So this is really, really common, and most people will tell you the story of, well, I went to bed and the left side of my nose was stuffy, and I woke up stuffy, and I woke up 3 hours later, and then now it was the right side. So some of this can be positional. Stuffiness has a couple parts to it. One is blockage. If you've got mucus, or snot or something else in your nose. The other part of stuffiness has to do with swelling of the lining of the nose or the tissues inside of our body. And that inflammatory process or swelling inside our body can actually be positional. So if you're lying on one side of your head, blood flow will kind of move that way a little easier than it moves to the other side, and that can contribute. The other piece of this is if you do have an infection, as we were talking about earlier, it is possible to get infected on one side of the nose, although because we tend to pick our noses, we often get it one side to the other pretty quickly. You can be infected on just one side of your face.
Maybe I can ask Dr. Freeman, septal deviation, I mean, isn't everyone's septum a little crooked?
Yeah, it's pretty unusual to look in there and see someone who's just straight on right down the middle, that's for sure. So developmentally, minor trauma, and not every bent septum needs to be fixed. And,
right.
But certainly if you have, dramatic unilateral nasal obstruction, you see a significant deviation, and those can be addressed surgically.
Some are still fixed, sure. Dr. Glickstein, a caller from Ely, wonders, how common are blockages of the parotid gland, and what type of treatment is needed?
Acute parotitis, which is an acute infection of the parotid gland, used to be much more common before the MMR vaccine, and people would get the mumps.
Right in front here, yeah.
Yeah. So the parotid glands are the glands that are in the cheeks, and you'd see people with chipmunk cheeks, and this is many, many years ago, before the MMR vaccine was more or less mandatory. Basically, viral infections have probably been replaced by bacterial infections of the parotid gland, at least in my practice. It's the most common cause of swelling. Typically, it's related to dehydration, actually. So patients who are on medications that dry their mouth, whether those are blood pressure medications, depression medications, diuretics, etc., those can be a cause of it, as well as just not drinking enough water. Occasionally, one can develop an infection after a prolonged surgery, let's say. In terms of a fixed blockage of the duct, if you've had a prior infection, then possibly scar tissue can develop. I much less commonly see stones within the parotid duct. I have seen them occasionally, but typically after that, I do tell patients that they're at risk for developing some scar tissue in the parotid ducts. The most common treatments we offer for patients in this particular regard are elevate your head when there's swelling, apply pressure and massage from a backwards to forwards motion. Also to have lemon drops or sugar-free candy, lemon wedges, something tart which actually forces the gland to try to expel some saliva. And if there is pus or pain or redness of the skin, then often we will treat with antibiotics. In very certain select situations, you can actually dilate the duct if there is demonstrable scar tissue.
Thank you. Dr. Pernuski, we have a caller from ESCO wondering about clumps of mucus that's coughed up from the throat after a virus or bacterial infection. Is this something worrisome?
The body makes mucus in response to irritation, so having mucus in the setting of an infection is not uncommon at all and not particularly worrisome. I guess I'd need a little bit more information to answer for this particular patient. One of the things I worry about is whether or not something else could be going on. Could this be a sign of bronchitis, or early lung infection, or maybe even a pneumonia? And as you were talking about earlier, certainly heartburn or esophageal reflux. Heartburn can cause irritation of the lining of the esophagus. And people say cough up, but not sure whether it's coming from the lungs and the trachea pathway or the stomach and the esophagus pathway. So from a stomach-esophagus pathway could be heartburn. From a lungs pathway could be a bronchitis or early pneumonia. In general, when people tell me such things, as long as they're otherwise feeling well, I'll watch for a week, 10 days, and if they get better, we don't need to worry about it. If they're getting worse or have other symptoms like a fever or breathing problems, I'd want to evaluate more and make sure we're not missing something more serious.
Thank you. Dr. Freeman, a caller from Ashland wants to know, what causes a voice to lose strength?
Well, like in my case, it can be a viral illness. It's very common as people age to lose projection power in their voice. And basically, just as you develop laxity in your skin, you develop that same kind of laxity or atrophy in your vocal cords, and they don't tend to meet as crisply in the midline, so people tend to lose projection. They can get hoarse easily. They can, their voice can crack and split. In the elderly, that's just most commonly this changing physiology of their body. But they can be, in younger people, like I said, viruses, acid reflux. You can develop nodules or polyps on your vocal cord from vocal abuse and overuse. There's a whole variety of potential causes there.
We just have a few minutes left. Time's going quickly here. Here's to Dr. Glickstein, since you were talking about tinnitus or ringing in the ears. A caller from Trigo. Are lipoflavonoids useful for treating tinnitus?
So that was actually the one over-the-counter vitamin supplement that I was aware of that has, in a particular study, been shown to reduce symptoms of tinnitus by, the theory is, improving blood circulation to the inner ear, and that study was actually published. But again, whether you can extrapolate that to all patients with tinnitus, I think basically taking the medication on a trial basis, probably no longer than a month, if you would like to try to see if it works for you.
Sure. Dr. Pernuski, a caller from Duluth. What causes a constant runny nose? There's a lot of that going around.
25 words or less. There are many, many, many things which can cause runny nose. I think probably the most common would be allergy. But certainly vasomotor rhinitis, which is sort of increased blood flow to the nose, can do this in some patients.
Sure. Here's a question I'll throw out to anyone. Do we have more troubles with our sinuses and our noses and all this in this area with the climate? Does climate make a difference? All this dry or...
From my personal experience, I moved up here from Memphis, and I think the sinonasal and allergy problems are actually much worse down in the south than they are up here.
Oh, interesting.
Much worse. The nosebleeds may be worse here.
Yeah, nosebleeds are worse here because your nose is an air conditioner and it dries out in the super dry air. But I would agree in the southern climates where you have longer growing seasons and more allergens and more irritants, higher dust and particulate matter in the air, it tends to be more of an issue.
Thank you. Is there, Dr. Glickstein, since we're on tinnitus here, is there a you're a tinnitus person tonight. Is there a correlation between sinus infections and tinnitus? Can a sinus infection cause some ringing?
I think the main reason that you would probably see that would have to do more with the eustachian tube dysfunction that occurs with nasal congestion, meaning that the equalizing pressure tube for your ear is not working as well because it's swollen, which causes a dampening effect, I think, in the ear, and that, I think, could potentially lead to tinnitus.
Right. Dr. Pernuski, is there a good treatment for vertigo? A caller from Kettle River.
Mm-hmm. That depends on the cause of the vertigo. Some vertigo can be treated by physical therapy or positional maneuvers. Some vertigo can be very well managed with either over-the-counter or prescription medications. It depends on whether that vertigo is caused by blockages in the system that helps us keep our balance, or by infection?
Well, thank you very much. And just quickly, plugged ears for 6 weeks and like an underwater feeling. What's the treatment for that?
Well, it's probably from some minor eustachian tube dysfunction. If there's some hearing loss along with it, it probably means there's fluid there. 90 to 95% of people will clear fluid in 3 months if you just give them time.
Give them time. Well, thank you very much. I certainly want to thank our panelists, Dr. Todd Freeman, Dr. Jonathan Glickstein, and Dr. Jake Pernuski, and our medical students, Jackson Long, Christy Nowak, and Dan Svevum. Next week, please join Dr. Ruth Westra for our last program of the season on orthopedic problems and joint replacement, when her panelists will be Dr. Patrick Hall, Dr. John Redmond, and Dr. Joseph Signorelli. Thank you for watching, and good night.